Hi, this is Dr. Mercola. I want to talk to you about a very common condition in women called menopause. And menopause is simply when a woman stops having her period. And typically this is due to aging and regularly occurs around the age of 50. But it can be due to a number of other circumstances, and especially if a woman's ovaries are removed, and she's going to have a surgically induced menopause. Now, one of the common characteristics, and one of the reasons why it's so important for many women, is that they can have a number of different symptoms associated with it, and probably one of the most debilitating are these hot flashes, which can really devastate a woman. And it's important to have a strategy to address those. So if in fact menopause is a consideration or concern, we do have a hormone test, a blood test. It's a very simple test, non-controversial and universally accepted, and that is the FSH test, and that's short for follicular stimulating hormone, which is a hormone produced by the pituitary gland, and it's under negative influence. In other words, if it detects that the ovaries aren't working, it's going to, and there's no follicles in the system, which is what is released on a monthly basis if a woman's still menstruating. And if it doesn't detect that, then the pituitary gland will secrete this hormone, and the levels will rise. So if the higher the level the FSH is, the more likely is a woman's in menopause. And there's very simple numbers to diagnose it. There's no controversy on those. So interestingly, there's a number of strategies for treating this, and of course the most common one is estrogen. And many of you may not be aware, but when I first finished my medical residency training in the mid-'80s, I was actually a paid speaker for the drug companies. Paid speaker for the drug. They used to pay me to go and speak to physicians. And what did I talk about? I talked about estrogen replacement therapy, because at that time, 24 years ago, I was convinced that this was really great strategy for women because it was replacing their hormones. And I still believe that replacing women's hormone is a wonderful strategy. However, I have learned in my journey as understanding more about health and the human body that using synthetic hormones or even natural hormones from animals is not a wise choice. Now, the typical hormone that was used in estrogen replacement therapy was Premarin. And Premarin, you may not realize, is a shortened version of pregnant mare's urine. So what they would do is extract the estrogens from pregnant mares and then put those in a pill, and they would give it to women. That was the estrogen they were using. And it clearly was effective. It's a clearly effective estrogen. But it had side effects. And in fact, 5, 6, 7 years ago, became very, very clear, and now it's well accepted in all conventional and traditional medicine, that estrogen replacement therapy is associated with an increased risk of heart disease, and in fact has big black box warnings from the FDA. It's not that you can't use it anymore, but if you do use it, you need to understand that that's going to be a serious potential risk for you. Now, it was also typically, the estrogen replacement therapy was, especially if a woman still had a uterus, because you just can't give what's called unopposed estrogen, because that will cause the endometrium to proliferate, and essentially if that's done on a regular basis, it increases the risk for endometrial cancer, which is a relatively minor risk of developing into something more serious and malignant, but nevertheless it's well recognized. So if a woman still had a uterus, they would put her on a progesterone. That progesterone was typically not a progesterone, but a progestin, meaning it was a synthetic progesterone, and that progesterone was Provera. So we now know and understand that the synthetic progesterones are probably worse than the estrogens. So clearly you don't want to be on those, and you may not realize, but if you're taking a birth control pill, which I strongly advise no one to take, that's exactly what you're getting. You're getting a synthetic progesterone and a synthetic estrogen. So you really do want to avoid those, because it's not going to push you towards health. So if you do have this condition, then there are strategies that you can use. One of them, of course, is optimizing your lifestyle. So you want to make sure that you're getting the right amount of animal-based omega-3 fats. You want to make sure you have a good exercise program, that you're selecting foods that you're designed to eat, that are biodynamically, organically, and locally grown, that ideally that the macronutrient ratio is optimized so that you're getting the right proportion of proteins, fats, and carbohydrates for your biochemistry and genetics. And if you need more information about that, just look up nutritional typing on our site. And then vitamin D, it's so crucial. It optimizes and upregulates over 2,000 genes in the human body. So if you haven't had your vitamin D tested, by the blood test, then clearly go on my site and look that up, because there's important information you need to know about that. And of course, exercise. You want to optimize your insulin levels, and that's really going to be a crucial strategy. So these are some lifestyle changes that will help control those symptoms without the use of anything else. But if you're still having challenges, in addition to that, you can use, as I mentioned and implied earlier, natural hormones, something called bioidentical hormones. And there's fortunately a lot of good information out there now. And really one of the pioneers and the innovators in this area is Dr. Jonathan Wright. It's W-R-I-G-H-T, and he's actually one of my early mentors, and I've interviewed him a number of times for our Expert Inner Circle program. And he really has written a number of books and has really a solid program that you can use. And if you understand and apply that, you can safely go on bioidentical hormone therapy. But there's a number of other resources out there. So these are some simple strategies that you can use to address this very common challenge. But if you're leading a healthy lifestyle and you apply the principles that we teach on our site, the likelihood of you having to undergo any significant side effects with menopause is actually pretty low. So the ideal strategy, of course, is to be preemptive and preventive, and apply these strategies that help you, not only you, but you and your family, take control of your health.